from Sarasota Memorial and the Deb Kavanaugh Multimedia Studio. This is HealthCast, a healthy dose of information from experts you can trust.
Hi, everybody. Welcome to HealthCast. I'm Allison Gottermeyer. Thank you so much for joining us today as we talk about treating a patient's holistic needs with integrative care services. Our guest today is Mariah Pierre, a nurse and program coordinator for integrative care services here at Sarasota Memorial. Thank you so much for joining us today.
Thanks for having me, Allison.
What exactly are integrative care services and what does that mean for the patient?
So integrative care is taking the use of non-pharmacological or non-traditional treatments and combining those with traditional medication in the hospital setting. So it's focusing on the whole person holistically, mind, body, spirit, to treat them as a whole person instead of treating just the disease or just the symptom. It's really meant for inpatients and to target any bothersome symptoms that they might experience as a result of traditional treatment.
And it can target symptoms, but it can also really help them relax, because inpatient treatment for anything can be very stressful.
Yes, it definitely, a lot of them can help with anxiety, nausea, pain. Some of them are even useful just for general distraction. So it's nice to have a few different modalities available that we can offer to patients.
What are some of these therapies available to patients having some of the tough physical or mental side effects from their treatment at the hospital?
So currently we have acupuncture, we have music therapy, we have virtual reality, we have TENS, aromatherapy, just to name a few. We have pet therapy also, that's a very popular one too.
I know there are a ton of offerings, so how can patients go about finding out what's available to them?
So some of these services are based on volunteer availability and availability of the pets or the specific service that's being offered, such as acupuncture, which is kind of determined by location. So anyone that voices an interest in integrative care, we can get with the provider and kind of tackle that together, see what would be good for them and see what's actually available to them at that time or on the unit that they're on.
Some of the therapies you mentioned kind of seem self-explanatory, but I want to dig into some of them a bit more and how they might help patients.
Sure.
So let's talk about virtual reality. How is it used for patients at Sarasota Memorial and how does it help them?
So virtual reality is a really good tool for distraction. So people that have been in the hospital for a prolonged length of stay or patients that are anxiously awaiting test results, it's a really good form of distraction to kind of take the patient away from their environment. So the virtual reality headsets that we have currently have meditations on them. There's some game offerings. There's some just guided scenery, so you can leave your hospital room and be on a beach in Hawaii. So it's a nice distraction, and it offers just a little bit of an escape when you need it.
For the patients who have used it, what have you seen kind of their response to it be?
I think a lot of times I'm experiencing patients using virtual reality for the very first time in the hospital, so it's really cool to see how they react to virtual reality and how realistic they feel like it feels. Some people, like people that are having nausea, we don't recommend because it really feels like you're immersed in that experience. So it'll depend on the patient's symptom, but they all feel like they're transported from their hospital room right into that environment, or they're active in that game and playing exactly in the scenario that they're in. So it's really interesting for the patients to be able to experience that.
You also mentioned music therapy, which I know is wildly popular. So can you talk a little bit about that here?
The patients love music therapy, and I personally am very proud of music therapy. We have recently actually employed our very own full-time music therapist, which a lot of healthcare organizations don't have. They're either contracted or they're not able to offer music therapy. So I'm super proud of how far we've come. We started off with a contracted music therapist, and now we employ our very own full-time music therapist. She went to school for music therapy. She's board certified. She has specialty certifications in neurological music therapy, and she's working her way through some other certifications such as palliative and hospice care. So she is able to sit down with the patient and really establish like mutual goals that they're working towards. So if they need to cope with a new difficult diagnosis, if they need some tools for handling anxiety, if they're having a lot of pain and they need to figure out a way to kind of go inside themselves and relax, Shauna is able to really build those great therapeutic relationships with patients and reach those common goals together. There's different things that she can do with different techniques, of course. One of my personal favorites is progressive muscle relaxation. So that is kind of like a guided meditation when you tense and relax your muscles, and she works her way through the whole body. And by the time you're done, you don't realize the places that you were holding stress, that you're just able to kind of breathe and let it go. A lot of patients choose to do that one, and it's very helpful for them.
So it's a lot more than someone just coming to your room and playing music for you.
Yes, we've come a long way. She's not just singing happy birthday or doing entertainment for patients. She's really picking either generational music from decades that are meaningful to them, or working towards something that they have talked about, like guided meditation or the progressive muscle relaxation.
Another local favorite that I also know involves a local partnership is something called Art Tours. Can you talk a little bit about that?
Yes, the Art Tours is actually our partnership with the Ringling Museum here in Sarasota, and that is a virtual art tour. So patients at the hospital end are able to take an iPad and use that kind of like a remote control that actually steers a robot around a gallery at the Ringling Museum. So they have a representative from the museum on the side at the actual museum, and then on our end here at SMH. And the patients are able to zoom in, to zoom out, to look at the artwork, the frames, the gallery. They discuss with the employees of the Ringling what the artwork means to them. What would this look like if this was your family portrait? Do you like the colors that are used? How does it make you feel? So those can last anywhere from 5 to 45 minutes, depending on how interested the patient is and how much they want to know about the art. Some patients want to know about the history, the time period, what was going on, and some patients just like to look at the pretty artwork that's there. So that's been a great experience too. We've had really great results with distraction, especially on the post-surgical floor. So that's been great for the patients there.
And because that uses an iPad, not those virtual reality glasses, more people are able to use it, right?
Yes, and people seem a little bit more open to that. It's kind of like, using an iPad is like using a big phone. So people are a lot more familiar with that than they are with putting on a pair of virtual reality glasses. So that one's very well received, and patients often want to do it like with their families too. So we'll wait until their families come to visit, and then they'll do it together. We've had roommates that do it together because they build a special relationship being in the hospital together. So it's been a really good experience for them.
And then it's almost like going on a field trip or going on a family outing to visit the Ringling Museum.
Exactly. And they're able to learn more about the Ringling and what they offer. And there's a lot of community outreach programs that they have that they're able to find out about if they want to make it there once they get out. Sometimes that's their goal. They want to get out of the hospital, be healthy, and make it to the Ringling Museum. So they help facilitate that too.
You also mentioned acupuncture, which I know is something a little bit newer to Sarasota Memorial. Can you talk about how that's been used?
Sure. Acupuncture is new to us, and we actually just finished a pilot with oncology patients. It really had great results, especially with pain. So we studied pain, anxiety, nausea, and overall well-being. And we had statistical significance in every category that we measured. And the greatest was with pain. And we're hoping that soon we can expand that service and offer it to other patients throughout the hospital.
That's great. You mentioned TENS. That's one that's a little less self-explanatory. What is TENS and how does it work?
So TENS stands for Transcutaneous Electrical Nerve Stimulation. And that is a little device that a lot of people are familiar with using at home nowadays. You can get them on Amazon, things like that. And they're used to treat either acute or chronic pain. So here in the hospital setting, sometimes it's used post-surgically around incisions, things like that, to help manage pain for patients that don't want to use opiates or pain medications, or that shouldn't because of other medical conditions. So it's a great adjunct therapy to add along with a good pain regimen. It's just small little electrodes that are applied on either side of a painful area. And then it uses little nerve impulses electronically to stimulate or block the nerve connection to the brain there.
How have you seen that help patients in our community who are here in the hospital? What's their reaction to it?
A lot of patients that like it, you either like it or you don't like it, and that's part of the great part of Integrative. You can say no if you don't like it, but you're always open to try it and see how you feel about it. A lot of patients that do use it post-surgically seem to have really good outcomes. Also with chronic pain, like low back pain, patients seem to enjoy it for that as well.
Another one that I know we have here at the hospital is listed as the M technique.
Yes.
What is that?
So the M technique is our version of manual touch. So the M technique was actually created by an ICU nurse, not one here at SMH, but it was created and taught by an ICU nurse who trained us, and we're able to keep that training ongoing to people who are interested. So we have a variety of different roles in the hospital that are trained to provide the M technique. So nurses, techs, nursing leadership. It really just provides a good opportunity for you to be able to sit with your patient, spend some one-on-one time. It's done in really smooth, flowing motion, so it's relaxing to perform as well as to receive. And we actually have patients who ask, like, can you teach my spouse how to do this so they can use it at home because it was so relaxing, or they would like to learn it to do it for their children, or, so it's a good learning experience to be able to teach it so patients can continue to use these things even when they're discharged from the hospital.
Are there any other services offered that patients really seem to appreciate or seek out?
I think aromatherapy is a big one. That is one that patients tend to use outside of here. So they're really excited to see that we do offer that inpatient as well. We offer it as little aromatherapy inhalers. So that one is very well loved. Pet therapy is another favorite. So we have dogs that come with their handlers who are volunteers and make their rounds around the hospital to see patients. And they also are available downstairs if patients are able to get off the floor for a little bit with their loved ones to go visit the dogs down there.
And as you mentioned, though, they're not here all the time.
We wish.
We do wish. But if you're interested in those therapies, you can always ask, hey, is pet therapy coming, right?
Exactly. Some units are lucky enough to have volunteers on a consistent basis that come weekly or bi-weekly. Some units don't have assigned dogs, so we round with them around the hospital, and we have a working list of nurses who communicate with us to let us know, my patient's really missing their dog and they would love to be able to see a dog while they're here. So we add them to our list and we make our rounds as best as we're able to with the wonderful volunteers that we have who volunteer their time and their fur children to share with us.
Any of these therapies, even the ones we haven't talked about, do they cost extra for the patient?
Right now they don't. There's nothing that costs extra for the patient. It's included with your stay at Sarasota Memorial.
So who is eligible to receive the therapies while here at Sarasota Memorial?
Any inpatient is able to request any of these therapies from their provider, and then we'll take a look and assess and see what would be most beneficial for them. So depending on the symptom they have, or a couple of the therapies have some contraindications where it may not be the safest option for you, but we look at all of that. We discuss with you what's really going on. What are you feeling? What are you facing? Do you want help trying to manage pain? Or are you really having a lot of anxiety or nausea? And then we can tailor what services we try first based on the patient's answers.
Why is it so important to have these integrative care therapies available for patients?
I think it's important for patients to be able to have a say in their care, right? Everyone wants to be able to have some kind of say in what happens to them while they're here. So it's nice to have patients be able to be involved in that. And then even if the answer is no, it's a choice, it's a rare opportunity they have to be like, you know what, if it's up to me, I don't want to try it right now, or I've never thought of that, but I'm really interested. So it's a good opportunity to involve the patient in their care and to allow them to make a decision on their own health care, which is really important.
And I know you work with a team that's really dedicated to growing these offerings. Can you talk about the uniqueness of having such a robust integrative care services offerings in a healthcare setting like ours and a public hospital?
I think the fact that we are able to integrate so many of these things that patients are using outside in their everyday lives into the inpatient setting really just shows how we are keeping up with the times, and we are trying to always provide the best patient care. So you know yourself, you know things that you've tried outside of here, and you know things that work for you. So it's nice to be able to integrate some of those things that are maybe not so traditional or not offered other places, but you know yourself and you know what works, and we're able to provide some of those for you while you're inpatient. I have a great team. We do a lot of research. We're always doing innovative, different things things within our entire team. So looking to keep up with what other people are doing or pave the way on things that haven't yet been explored in the inpatient setting.
And as you mentioned, it's not just things you know work for you. It's also trying new things. Maybe virtual reality isn't something you have at home, but you're interested in the distraction.
Exactly. Sometimes it's a good way for you to figure out things that you can use outside of here, tools you never thought of, or simple interventions like a cold washcloth on your forehead, like simple things that you're like, oh yeah, even us as healthcare workers, sometimes you kind of forget the basics. So going back to those and trying other things that aren't necessarily medications or not necessarily considered traditional treatments, but there's something that you find that works for you, and then you continue using them at home.
For those who are listening and may have a planned hospital stay in the future or may end up here after listening to this, is there anything else you want to add for them to know, or even for their loved ones to know as caregivers?
I think just knowing that we have these services available puts you a little bit ahead of the curve. We do teach all the nursing staff and the new nurses. They go through some of this stuff. They try some of it out. So it is exciting and they do know all about it. But sometimes it's not the first thing you think about for anyone. So it's nice to know that these things are available. And that way you can advocate for your loved one or for yourself if the things that you're trying aren't working or you'd like to just try something different while you're here. If you've never tried acupuncture and you're here and you're on the oncology tower and you want to try it, then now is your chance and we'll see if it works for your symptom that you're having. If you've never seen music therapy in action, never experienced it, that can be a really great experience too. So it's a good opportunity to try these things and kind of think outside the box and figure out what works for you and what you might not like to try again.
Absolutely. Mariah, thank you so much for joining us today. As always, we encourage everyone in our community to visit smh.com to get the latest from Sarasota Memorial. Have a great day.